So, pakinggan na po natin yung isa pang sinasite ng mga resource persons natin na unang nagsalita mula sa Alive and Thrive East Asia Pacific, Dr. Paul Zambrano.
Good morning, Madam Senator.
Good
Madam
morning,
Chair.
Doctor. You have the floor.
And good morning to all our colleagues, sa mga kasama natin sa mga iba't ibang alyansa na nagsalita. It's very humbling po to hear from the potential beneficiaries of this bill, and also very humbling to see na yung work that we started with Ms. Babes and other colleagues has also reached this point. So there's a lot of progress, and we're very humbled to have played a role for that. So thank you so much to the Office of Senator Risa for taking up the findings of our research. And just to reiterate what Ms. Babes mentioned, this was a collaboration between many actors such as Always and PIDS. So I'm one of many authors and contributors to this study. But all the same, thank you so much. I will start by saying that we anchor this bill on breastfeeding. And we do know that breastfeeding affects all the SDGs, not just the health-related SDGs. We know that breastfeeding has health benefits. We've heard from everyone, lahat na nagsabi ng health benefits, alam na po natin to. Pero marami pong nagbago din sa kaalaman natin. Simula nung na-publish namin yung paper na to, mabilis umaandar ang ebidensya. Isa dito, mas marami ng ebidensya sa benefit ng breastfeeding sa maternal health and maternal mental health, hindi lamang sa physical health. Pangalawa, mas kinikilala na po ng mundo, hindi lang ang health benefits ng breastfeeding, kundi ang economic benefit ng breastfeeding. Not just the economic benefit of breastfeeding itself, but the economic benefit of the breast milk itself. Ito po ang first food system. Ito po ang pinaka-food secure na source of food for our infants, and has tremendous benefit not just to food security, but also to greenhouse gas emissions compared to using commercial milk formula. And we're also learning more about the economic consequence of poor breastfeeding practices. So economic po lahat, the benefits and the consequences. That's why nung Lancet po, it's the most prestigious medical journal in just this year, they published a new series which highlighted that breastfeeding is a collective social responsibility, and that part of the policy action should be the equitable implementation of maternity protection policies. And in many cases, they also mentioned that in many countries, the gap is in the coverage of informal sector workers. So we know that the economic contribution of breastfeeding and breast milk is there, but it's tied to our recognition of the economic contribution of unpaid care work. And this also ties up to the need to ensure that informal sector workers are adequately covered by existing entitlements, or if none, then we need to act at policy level. But we know that it's challenging for policy to often determine how much. Magkano ang policy? Magkano ang implementasyon? What is the cost of action and not just the consequence of inaction? And in our paper, we cite similar costing studies in Ghana and Brazil and in Mexico who applied a similar costing model to determine the financing need to cover informal sector workers through a maternity cash transfer, a non-contributory maternity cash transfer. And the good thing with our costing model doon sa paper is that it can be flexible to different scenarios. We model different scenarios in the paper, but should we decide to maybe tweak a few of them, including how we define informal sector workers, the model is able to do that. So we at Alive and Thrive are, of course, ready to continue to provide technical assistance as needed on the costing side, or to better articulate the overall evidence for this policy and how it ties up with breastfeeding and our SDGs. And we have existing capacities for economic analysis and often collaborate with world-renowned health economists and feminist economists as well. So we are able to support moving forward. And we are prepared, and we're also preparing a technical note, which we will be submitting after the meeting. And again, I'll end by saying again, thank you so much to all of you for taking up our research and for collectively recognizing this important gap in coverage. And a belated Happy Mother's Day greeting to all our mothers in the floor. Thank you so much. Back to you, Madam Chair.
Thank you so much also, Dr. Zambrano. It's great to hear na yung pananaliksik nyo at yung advocacy nyo anchored on breastfeeding and the SDGs, shedding new light on breastfeeding's good effects for maternal mental health, and of course the economic benefits not only of breastfeeding but of breast milk. Ang ganda po nung yung breast milk is actually the first element in food security, no, of a society and of a country. At napaka-interesante din yung kaugnayan nito sa effort natin nationally and globally para bawasan yung greenhouse gas emissions sa ating planeta. Ang ganda din po ng language dun sa Lancet about breastfeeding being a collective social responsibility. And just to also go back dun sa mga unang inputs ng lalo na ng DOF at DBM, I think malaking tulong po sa komite, lalo na pag pinadala nyo na po, Doctor, yung inyong technical note, yung costing studies nyo, saka yung costing models na dinedevelop nyo. Mabuti yung studies from Ghana, Brazil, Mexico, so mga nasa Global South din tulad natin sa Pilipinas. Maybe we can be the first in Asia kasi meron na ditong Africa, may Latin America. Baka pwede tayo makadevelop ng unang costing model for Asia. So, looking forward talaga po dun sa papel na gagampanan ninyo at nung research ninyo hanggang pa sa technical working group. So, maraming salamat po.